Study was led by Tom Pike. He was at home because of the COVID situation and started looking at the data, looked at the Chinese data and began to compare China to Italy. And what he found was when he looked at a particular metric, and that is the rate at which deaths were growing, he found that from the time China implemented its lockdown, you saw a nice steady decline in the rate of the growth of death rates, and that Italy was tracking that, remarkably well. In the first few days, it was, suspicious day after day. Every time he updated them and we looked at them together, it's continued to bear out. And then as we looked at other countries, we started seeing the same pattern. So it struck us as a potentially useful tool to be looking at these death rates as a way of getting a handle on what's happening. And in particular, to the extent that various countries are actually following the Wuhan curve down, it allows us to make some projections and do some calculations on that basis. And that's what we've been doing. So this paper showed these curves for different countries, showed some of the projections for other countries. And it raises, I think, important questions about how stringent the social distancing needs to be and what else we need to do. But fundamentally, it shows that as early as a country gets onto the Wuhan trajectory, the sooner it is that you'll start to see some change in the growth of death rates and eventually extinguishing that growth and seeing a decline. So that's kind of what the study shows.
So for just to have some clarity here for people who may not be of a particularly scientific background, you were talking specifically about a second derivative, and that relates to the rate of death. Could you just spend a little bit more time talking about what that means?
I'm sorry, could you say that again? I was distracted.
Just getting some more clarity for people who are watching that may not be of a particularly scientific background, but really want to understand what you mean by second derivative and what exactly is being tracked.
So what's being tracked, so we take the deaths on a given day. We call that a rate, which is to say the rate of death for that day is a daily rate. And every day it's a different rate. We then look at the difference in the rate, which is to say, that's what it means to call it a second derivative, and effectively say, what's the rate of change of the rate? And that's what we're looking at. And that turns out to be, in physics, it's kind of a very simple, basic approach. Mathematically, it's also, close to trivial. I think that from my point of view, it's probably just a little more sensitive, and it just clarifies what's going on a little more clearly. And I suspect, though I'd check with Tom on this one, suspect maybe a little earlier than other ways might detect it.
Yeah, there's I think a lot of what you might call like noise out there. There's a lot of data flying around. And what we're getting from countries may not be consistent from country to country. So like looking at cases of COVID-19 or looking at hospitalizations, let's say, maybe in terms of getting really the best concrete data, the deaths is maybe a really good variable to be looking at compared to those other things.
Well, when we started, given the paucity of testing in many, many places and the uncertainty about what's a real case and what isn't, it seemed to us that was the best way to go. I mean, this is how Tom started it, and I think that was the right decision. We have been reporting it, and Tom started looking at online reports of confirmed COVID cases and those deaths. So there's always a little noise and error, but we thought that was the sort of hardest of hard endpoints, as we say in healthcare, and as such, probably the most reliable.
All right. Well, we've been talking about this, the China data and the way that it sort of sets itself up on a graph. So let's bring that up, and let's actually take a look at that line from China. There we go. So if you could explain to the viewers, I think we want to focus on the red line here. And that's the
Yeah, so the red line is the plot of, as we say on the left, the second differential of total deaths. So it's the plot from China. The long red vertical bar is the start of their social distancing, which was actually January 23rd, if I'm remembering correctly. And so we've shifted that China line to correspond to another country, which is the black line. And that's how we're sort of using the China curve as the benchmark.
And if you, just to be really clear for people, walk them through the line as it's declining and where it ends up.
Well, I mean, I think what you see is if you start the red line, it starts at a rate. So this is, I think, somewhere between 0.3 and 0.5, and then it's declining very gradually. The problem is I'm not seeing the x-axis on this, which we have, so I can't exactly tell you what that rate is. But in fact, it's been typically over the course of 4 to 6 weeks. So that's kind of what we're seeing here.
Okay. So what your study did was to take this pattern that we're seeing in China and use it sort of as a template over which other countries can be imposed. So let's go ahead and do that. If we could start with Italy, we're going to bring up the Italy visual. Italy's obviously been in the news a lot. Things seem really bad there. Hundreds of people are dying. But based on what we're seeing in your study, well, what are we seeing in your study?
Well, sure. First of all, the very most obvious part of this is the black line, which is Italy, is really very nicely on the Wuhan trajectory. So the rate of growth of deaths has been declining. I think, we track this from the point at which the Italian rate crosses or converges onto the Wuhan rate. So that's how we start this. Before that, there's a lot of noise. You see in the Italy black line before they converge, there's a lot of noise. Statistics are sort of weak. The numbers are small. So there's noise, and probably very early on, it may also reflect the lack of social distancing. I mean, that's speculation. But once it converges onto the Chinese line, we see that it goes down quite nicely. And I think the other point I would make is that in the last few days, in the media, many people have been commenting that the Italian deaths seem to have, been lesser each day. And I think our graph confirms that. But what's important from my point of view is we've been looking at these really for 10 days. And so we, a week ago, started expecting to see the decline in Italian death rate growth that we are now seeing. So it gives us cause for optimism that if this trend continues, those numbers in Italy will get better still. And also gives us reason to believe this may give an early indicator of where a country is headed.
So while we're looking at this Italy chart now, and I think we've maybe even seen a more recent version than this, because I know you're tracking this stuff daily. It looks like the peak is, we've passed the peak of the crisis there, and we're on a downward, clearly on a downward trajectory.
Well, I think we have to be careful when we define what the peak is, because what we're saying is we've passed the peak of the acceleration of the growth in the death rates. but we could still be a few days away or a week away from the peak of total cumulative deaths, because what we're saying is the rate of growth is declining, but every day there are more deaths. So the final sort of peak may still be ahead of us, but it's on the right path. That's the most important thing.
And in addition, this is a specific cycle that we're looking at of outbreak, and that even if this dies down, there could be additional and likely will be additional cycles of varying intensities. Is that true?
Well, I mean, that's not something I'm really qualified to talk about. I mean, almost all the epidemiologists I've been following and reading their views on this seem to think that, it's almost a certainty that there'll be various types of second waves. And certainly we're already beginning to see little hints of that. For example, in Hong Kong and a few other countries, China itself is concerned about importing cases from outside China now. So that's one version of a second wave. There's discussion about, whether or not there'll be a seasonal second wave. So there's a lot of other aspects, but I think it's fair to say that, we shouldn't assume that once we get, to the end of this cycle, everything's fine. By no means is that likely to be the case.
Okay, let's take a look at another country. Can we bring up Spain? Can you talk a little bit about what you're seeing here in Spain?
Well, so the thing about Spain, which is hard to see here, but we'll see in later graphs, is that, it sort of went up pretty rapidly. There was a lot of noise in the early data. It now does seem to be converging, but what we know is that it's at a slightly later point in the course of the epidemic, and therefore when we see the total numbers, we're going to see bigger total numbers for Spain. And I think, if anything, to the extent this measure is helpful and helps us project these things, it tells us that the earlier the better is really the case. Every day, and we've known this, so you didn't need these graphs to understand this, but we've known for the last month or two, which is why so many people have been, healthcare people have been, running around with their hair on fire talking about the need for social distance, that we know that every day counts. And I think our graphs and comparison of countries sort of confirm that.
Right. Let me take a moment just to recognize people on Facebook, and that we do welcome questions. We're about halfway through here, and when we get to the end of the presentation, we'll be glad to field questions that you may have. Okay, this was Spain. We did Italy. Let's move on to the UK. Okay, I'm seeing it now.
Yeah, so the UK started out, noisy. It did begin to converge on the Wuhan trajectory, about a week ago, 10 days ago. And remember, we're aligning this to social distancing. And so I think people who've been following the news in the UK will know that there was a debate for a while. But around, that point that we've marked with the vertical black line is when the United Kingdom went in a major way for social distancing. And we do see the trajectory converged onto the Chinese one. That big drop at the very end all the way to zero is just an artifact. It's an artifact of the fact that the UK government at some point changed the rules on reporting the deaths. I'm not fully aware of all the details. If we get Tom Pike on this, on the next time we do this, he'll probably have more information about it. I know it had to do with the issue of sort of getting consent of families, but to me that really makes no sense, in the sense that, these are raw data. There are no names involved, and I see no reason why they can't report those, and I suspect they may have already reversed that. But that's that explanation, and shows, what authorities do and how we manage data, and all of that is actually pretty important in times like these.
I will take another moment just to note to people who are watching. I understand that the visuals may be a little bit blurry on Facebook. If you go to our website at lowninstitute.org, and I assume shared through our Facebook page, I know we've shared it. We did put out a press release, and within that press release is a link to the preprint study. So you can actually download the study yourself, and all of the charts are available in there. So let's move on. UK, next let's look at the Netherlands. Okay.
So the Netherlands, I think to me, what's most interesting about the Netherlands, first of all, I think it is also converging. So it does appear to be the case that it's following this trajectory. When we looked at the implementation of social distancing measures in the Netherlands, it was, kind of more measured, slower, and more targeted than most other countries over about a 2 to 3 week period. And even at the very end, there was not a total lockdown of the country. There was what the prime minister called kind of intelligent lockdowns or targeted lockdowns. And so, to the extent, and it's still, a theory, but I think a pretty plausible theory that it is the social distancing that's a major driver of these declines that we're seeing. Though it's a theory, I think it's probably a big factor. And if that's true, then what the Netherlands curve suggests that's interesting is, they didn't do a massive lockdown. They did certain things systematically, and it looks like, at least by this curve, something's going right. And so for me in particular, but I think for both Tom and I, this is cause for some, it's speculation that the range of stringencies, how tight you have to make the lockdown, may not be as great as getting to some minimum threshold after which you start seeing these results. But that said, we're talking about deaths, right? So at the end of the day, we're still talking about something, very, very profound and serious. And so, you'd want, in the ideal world, you'd want to have no spike at all, right? You'd want the death rate to be zero. But I think it does illustrate that we don't know enough about, and probably in the public health world, there'll be people who'll be looking at all this data, not ours, but all the data from this crisis to try to better understand what works, what doesn't. And the reason that's important is, we clearly, all of us all over the world, are facing this trade-off between economic activity that's, substantially shut down because of these measures, and, the sort of attempt to save lives and reduce suffering. So that trade-off, really is highly dependent on having a better understanding of how much is enough in terms of social distancing.
We have a question from Facebook. And I wanted to see if you knew the answer to this. When we look at the line for the red line, which is China, it looks like there's a pretty steady decline, but there is a blip in there. Do you know what that is?
I'm not sure. I have to, because the x-axis is the Netherlands timeline, I'm guessing it's related, though I can't tell you exactly why. It's related to the change in the Chinese definition of what is a COVID case. Because remember, we looked at rates, and we looked at rates of confirmed cases. So if the number of quote unquote confirmed cases change, it wouldn't change the number of deaths, but it might change some of how certain deaths were attributed to COVID. I'm at this point speculating on that. We haven't looked at that carefully.
Okay, thank you. All right, that was Netherlands. Let's move on to South Korea. South Korea is one that looks a little different than the others. So we'll give
Yep.
that a chance to come up for people. What's going on here?
So a couple of things. The reason you don't see the black line on the left the way you did in all other countries is that the South Korean death rate and the number of deaths really wasn't enough statistically to be able to run this in a meaningful way. So it's only kind of when they got close to their peak that there were enough deaths that the statistics worked. And what you see is that when they got close to their peak, they were already at the sort of Wuhan trajectory, and they went down from there. And that tells us a couple of things. One, their baseline number was small to begin with, which is why we didn't get statistically valid results early at the height of the sort of growth phase of this in South Korea. It also says that, they converged very, very late in the Wuhan curve, suggesting the measures they took were, got there at a much earlier point, much more effective point. And we know that the South Koreans did this in the way that I think every country in an ideal setting would have done. Sadly, did not happen, but would have done, which is massive testing, fairly intensive and sometimes intrusive contact tracing and isolation and quarantining of cases, and then some broad measures of social distancing. But I think it's sort of illustrative of many things, and I think people are going to be looking at the South Korean, they already are, and will continue to look at the South Korean response to this crisis as one which is something that many countries, will want to try to emulate.
I think if we can go to our next chart now, where we overlay all of the countries we've talked about, including some others, onto one chart. The point you just made about having or intervening early and intervening as aggressively as possible can really make a difference in the total number of deaths, or at least the rate of deaths that occur. Could you explain what we're seeing in this visual?
Sure. So here what we're seeing is, so first of all, when a country converges onto the Wuhan curve, we're able to at that point, take the deaths so far in that country and then use the Wuhan curve as a kind of multiplier to estimate where that country will end up. And this shows that at the level of the daily rate. So these are daily death rates. And so, for example, South Korea is that purple line from January through March, flat as a pancake. China is in red, and it's that sort of very low line between February and March. And all these other countries are, later. And what we see there is that Italy, is very close to what we might expect is the peak in its daily death rate. So Italy seems to already have turned the corner. But what this is telling us is, if it's a sort of orange or mustard line.
If our producer could put her pointer onto the orange line, there we go.
Yeah, thanks. Yeah, right there. What our projections are saying that even if Italy's daily rate went up for the next few days, it would not prove that it isn't on the curve. But what we can also say is that if it continues on the curve, it probably is kind of mid-April before you'd see a very, very substantial drop-off in the daily death rate. And because Italy came onto the curve, the Wuhan curve, a little bit late, that rate is much higher than it is in China. And of course, you can do the same for each of the other countries. And what you see in the very light mint green or greenish yellow, the highest peaks are for Spain, where we think that it would not be surprising. And again, basing this on an equation. This is not science, but it's also not kind of theoretical modeling. We're using the actual data. But what it says is that for Spain, in the first week or 2 or 3 in April, we may well be seeing 2,000, daily death rates in the 2,000 range. So I think at the time it's going to be very, very upsetting. But our data is suggesting that that's already baked into the cake. But it's unfortunate, and we shouldn't be shocked or surprised into making any other sort of necessarily rash moves. It might help in planning. We don't know that. This has never been validated. This method is so early. And just, I will say that the United States is the sort of lightish green sort of mint, which is below Spain, that one. And I don't know about those numbers. This is just what's being generated by the data and the equations. But I think the United States is so early that I think this is going to be subject to revision. I hope that, it stays as low as it is. It's still pretty high. I mean, we're talking about 1,000, potentially 1,000, 1,200 deaths a day in the US by mid-April. But it could get higher. So I think we should be prepared.
Yeah, it's for those watching, we are going to look a little bit more closely at, or a lot more closely at US and what we do know, in particular at New York, where there's, been the most severe outbreak recently. So just hang on for a few more minutes. You brought up something that I think is important when people who really want to understand the study, and that was about the difference between a model and the type of analysis that you're doing. Could you just sort of talk to that for a second?
Well, yeah. So epidemiologic models, take the sort of various measurements or factors associated with an illness, particular virus, whatever, the transmission rate, population size, a number of parameters. And based on what we know about how diseases spread, they can construct these models, and based on those models, make various kinds of projections. And typically, there's a broad range, which is, called a sensitivity analysis, but essentially you'll get a lower end of a range and a high end of a range. And so those models made a lot of news, I think, last week, and continue to do. One out of, Imperial College, where they projected that for Britain, the low end of total deaths might be about 5,600, but the high end could be as high as 500,000, which I think got everybody's attention, including the Prime Minister's office. And I think their modeling also showed that for the US, they could project up to 2.2 million deaths in that model. So we're not modeling in that sense. We're actually taking the data as it comes in. So this is much more an empirical understanding of what's happening, and we're deriving an equation from the actual data we have. So in that sense, it's more like, what physicists would do when they see, a body in motion, and try to derive an equation, and then use that equation to try to predict where it's going to be, a few seconds later. So in that sense, it's not really a model, though the forward look based on the equations, you could debate whether that's a model or that's just a prediction of another sort.
All right, let's move on to the next, I think is a table where if you do follow things to their natural conclusion, if things do continue to follow the Wuhan trajectory, what does that actually mean? Your study does assess what might be the total deaths and maximum daily deaths by the countries that you looked at.
Sure. So that's the left-hand column, and what it shows is the actual numbers for China. We have to date stamp all of these things because this is a moving target. But whenever Tom put this one together, I think that was the number. And the projections from that date, and remember, those projections change as we get more data in, from that date were that Italy might be looking at total deaths of 28,000, Spain 46,000, and the US 28,000. Now the US, again, 28,000 is a far cry from the 2.2 million that was projected. But I'm uneasy saying much about the US because it's such a big country, because we have so many potential locations where there are going to be local epidemics. And I think we have highly variable implementation of things like social distancing. So that's probably the number I would be least willing to defend. What's interesting is that the United Kingdom's number that we got of 5,700 is really pretty close to the estimate from the modeling study last week out of Imperial College. They had a lower estimate. Like if everything was done, social distancing, all the different pieces were put in place, they modeled what could we be looking at. And they came to a number, I think, of about 5,600. And so our equations looking at the actual numbers that we have suggest an estimate for the UK of 5,700. So that makes us, feel like this has some basis in reality and is not just, completely, excuse me, is not just completely, theoretical.
All right, let's go ahead and look at the U.S. data that we do have. I think New York is the place where the data is the best, and I know that you've looked at this just recently. There's a lot of attention being focused on New York right now. So it looks like this is the same type of graph we've been looking at, but brings in the New York data.
Yeah, so we just started looking at the New York data yesterday. Tom sent me this. He crunched these numbers this morning. And this is a plot in black of New York State. And in red is the China line, the Wuhan line. And the China line just starts where the New York and China lines converge. And that's, I think, makes it easier to look at, and it's helpful that way. So the first thing you see, is that, New York came on in a big way. I think anybody watching the news already knows that. So this is not particularly useful to know, but it is nevertheless striking that it came on with a very big acceleration. There's a lot of noise and variance when you start. It looks like it's at the kind of Chinese trajectory now, but it's still early. So I'm less confident of saying that than I am, say, of Italy, where quite clearly I think it's very much on the trajectory. But I think to the extent it looks like it, and we're going to track this every day, but to that extent, I think it may be helpful for planning and for better understanding what's going on. Because it's so early and because the numbers are already so high, the numbers that we might predict for New York are also going to be higher. And the time frame is also probably going to be a bit longer. We're still very early in.
Great. That's the end of the formal presentation and visuals that we're going to be sharing. We do have a question from Facebook. So as we were looking at all those shapes and following the trajectories of the lines, they all come down and they kind of flatten out at the end. And we know that one of the important factors here that is evident is that social distancing is what appears to trigger that downward trajectory. So the question, I believe, relates to does this tell us anything about when we can back off on social distancing? At what point in the trajectory, at what point do we wait until the line is flat and then after a certain time it's safe to go out, or some time earlier than that when it's already on the downward trend, or do we just not know from this data?
So I think when it comes to that sort of thing, I think caution is really warranted. What this data, I think, helps us with is for planning. because these are what if scenarios. Until it actually happens, I don't think it'll be solid. To put it a different way, I'd say as we get through this whole crisis, if this way of looking at the data truly pans out, then I think it'll be very useful for future management. But I would be uneasy with such an early look to start making big decisions on that basis. So that said, I think, it may help with planning, and certainly the time for relaxing social distancing, won't depend on this, because remember, this is a bit of an early indicator. It'll depend on the actual sort of numbers that we're seeing on the ground, and everybody, health departments, officials of various types, and through the media, most of us, I think we'll already know when that point is or is coming soon. So I think that's how I would answer that question. I would hope, that it would be helpful for planning purposes, and especially Europe seems to be ahead of us. So if this keeps getting confirmed in Europe, then I think it will be extremely helpful for us in the US state by state. But the United States is a continental country with multiple jurisdictions and multiple paths forward. So I think, we got to wait and see. My own view is that, it is just critical to maintain social distancing. And what we do on the other side is another big question. Because even when we relax it, we need to figure out what kinds of things should we keep doing anyway, even if we go back to work, even if we, go outside a lot more, even if we interact with people. And I think that may, over months, lead to some changes in habits that might be good from the point of view of future problems and future pandemics.
You had shared an analogy, I think you had heard about parachutes.
Yeah, I mean, I think relaxing social distance at this point, Tom likes to say that it's like, why would you cut off the strings of your parachute when you still have 1,000 feet to go? I mean, that would not make any sense, especially if it seems to be working. And by the same token, given what's happened, once you land, you want to pack that parachute up and have it with you. So I think, it's a reasonable way of thinking about this. And for all of us, I think it's going to require, a lot of thought about what we do as we go forward.
So following that same analogy here, the next question I think relates to when do you know when it's time to jump out of the plane? So the question is, how do we know that social distancing is successful when we don't know what death rates would be without social distancing?
Excellent question. And that's why this, in the classic language of science, this is just, we're reporting an observation. We're reporting a correlation. We think there's causality. Can we prove it? Not really. The only way you'd prove it is by doing an awful experiment that I think you'd be crazy to do, which is not do social distancing in one country and do it in another and see what happens. I think nobody in their right mind would contemplate that. So I think what we have to look at is what we know already. And you didn't need this tool. I mean, I certainly didn't need this tool, and nobody really did need almost any of the data that we now have coming in to understand that for an event like this, especially with a novel virus where the population does not have immunity, it's highly susceptible. And then once we got the early data on transmissibility and the so-called R naught, the rate at which it sort of propagated, you didn't need any of this to tell you that the faster, the sooner, the earlier you did all the three things that are important. The faster and sooner and earlier you practice serious social distancing, the faster and sooner you ramped up testing, did contact tracing, isolation, quarantine, the sooner and the more likely you would be to get some control on the pandemic. And there's plenty of discussion online and in the press now about flattening the curve, and so I'm not going to belabor that point. But at a minimum, you would hope to be able to do something that would allow the healthcare system not to get saturated, which is kind of what we're seeing in New York City right now, what we saw in Italy. And the nightmare of that is once the healthcare system's capacity to help people who really are sick get saturated, death rates may actually start rising because we can't rescue people.